Okay then, Alison. Do you want to introduce yourself? Because not everybody might know who you are and what you do.
No. Okay. So I'm Alison Sheils, and I'm one of the organisational development leads, and I sit within the people and culture services, and we've had some changes recently, so we're just sort of moving around and shuffling and rejigging where we are, but I sit in organisational development. So themes that I'm looking at are work around values and behaviours, doing lots of encouraging teams to do their behaviours into practice and working on that. We do lots of work with teams, so looking at teams that have gone through organisational change and supporting them, and actually wanting to get more involved in more strategic organisational development and linking. Essentially, I see it as linking the strategy of the organisation to the capability of the staff to do what we need to do, and thinking about how staff do that as human beings and how we work together. So that's me. That's what I do.
Brilliant. And today we're talking about something called KISS, and I know you want to ask me lots of questions, but I wanted to start with where you could just explain very briefly the survey that we've done and where we're at on that.
Yeah, perfect. So we launched a survey to try to understand from the organisation what has happened essentially within services, how people are feeling. So what changes have occurred that we like. So what do we want to keep in our services based on the last couple of months and the changes that have happened. What do people think they need to improve? What do people want to stop doing altogether, and what do people want to start doing? So it's a real OD piece of work, actually, thinking about that within services. We encourage services to think about stop, start, continue, but actually the KISS is quite a nice, we like an acronym. So it's how do we use that to think about your own services, think about organisationally, what do we need to know, what is it useful for us to know, and how do we pass that information on and share that. So I think the survey closed a couple of days ago, and we had just over 1,400 responses, and we're just working through that all. I say we, it's mainly Alex Lyon, but we're looking through that, and we'll sort of feedback the results and try to understand where we go from there and how we support services to make those changes that they might need to make. One of the big themes is around the IT, is people liking Microsoft Teams and the ability to connect with people without having to travel so far. So that's what we've done.
Brilliant piece of work. So have you got some things you want to float past me? Test me on?
Essentially, yeah. Really, what I was interested to know was from your perspective. Thinking about you and the board and the exec team. There's been changes, and just before COVID-19, there were changes in the board. Different people, new faces, and maybe not had chance to kind of settle into anything. And actually, then COVID-19 struck, and I thought, so what for you are the things that you're thinking on reflection? What do we want to keep? What do we want to improve? What do we want to stop and start? And just I thought it'd be interesting to hear that kind of stuff from you. Might be some different things that we haven't heard. So starting first of all then. So John, what's changed? What's different? What would you like to keep as a result of the different ways of working?
Well, Alison, you've already mentioned a couple of them actually. The transformation around our IT offer, the digital technology that we're all using now, has been a tremendous boon, hasn't it, to connect people. And whether it's MS Teams at work or Zoom at home or whatever, it really is, I think, transformational, and many people have worked really hard to get that up and functional within the organisation, not least the digital and the IT team. So it's a thanks to those people particularly. But it's such an enabler, isn't it, in terms of, for example, just being able to do this. We're increasingly doing pod chats with people, either individually myself or with the chair. But it also gives us the ability to get much deeper into the organisation. So it's really important to me to visit teams and talk to staff and find out how it's going, how we can help support them. But this is a much more efficient, potentially efficient way of doing it. So it's a definite keep for me, but it's also an improve. So how we can use, I'm sure there's more functionality behind this that we haven't been told about yet, because there's probably a lot to learn on how we could improve it. But the basic platform is a fabulous thing, and would really like to keep and improve that. And the second one in a similar vein is our communication and engagement with staff. I've had quite a lot of positive feedback from all sorts of people from across the organisation, saying thanks for the daily briefs, the information contained within, and I think people are feeling more engaged with the trust than they have for a while. And again, a thanks to everybody that contributes to pulling that together, because you can imagine we've had so much information and instructions coming into the trust, to collate all that together has been a real team effort. But again, I think that's an improve as well. I think there's more to do. Engagement isn't just about MS Teams, but there's lots of ways that was in the plan anyway, to engage with staff and make us feel part of the bigger family. So they're two to kick off with.
Well, lovely, thank you. I think it's really, really important. Around the engagement and thinking about the geography that we cover, and I'm really, Alex knows I sort of talk about it quite a lot in our meetings around engagement and making sure that the work that we're doing is not just in Nottingham and the easy to get to places, thinking about the staff that are in the far-flung corners and making sure that they feel connected and that they know that we know where they are and that we know that they're there, even just that is, I think that's really, really important. So that's really, really good to hear. What about things to stop then? What's the stuff that was maybe getting in the way, or just you found that actually we could just stop that and do things differently?
There's quite a list of things, so again, perhaps a couple of examples, again, which we'd started to look at prior to COVID, but have come into sharp focus. Bureaucracy. Don't we do a lot of stuff that doesn't add value? We've got people being asked to provide things that really don't serve purpose, and we've got into just a culture, not just in this trust but across the NHS, of producing papers and documents and this and that, and we get bound up by it. And again, COVID's driven a sort of coach and horse through that, really. So just a couple of examples. One which has become apparent was board meetings. We'd have board meetings with lots of papers that lots of people work hard at populating and filling with commentary and figures. And the board meetings now on MS Teams we don't have papers. It's all electronic, and they're shorter, to the point, and there's a real emphasis on so what are we going to do, and the time of the board is reduced significantly, and that's definitely something that I want to keep on, so that we have there's always a question around, so what then? Why are we doing this? What are we going to do less of? And the bureaucracy is something that we can really continue to sort of quash. It's important to have some. We can't just jettison it all, obviously, but just to sort of have an extra layer of thinking about, do we really need it? The other example is, again, something that we'd started to do and think about before COVID, but we're now pressing on with. So Becky Cassidy in the chair and chief exec corporate office is leading a piece of work around all our policies, procedures and guidance. So we have an apocryphal figure of over 800 policies and procedures across the organisation. Some, for example, that we only do this on a Wednesday afternoon if it's raining, sort of level. And Becca's brought a team of people together to really start to go through that with a clear remit to really thin those down, so that we've got, you know, a short, focused set of trust policies that enable staff and support staff to do their jobs, rather than being either of not much use or barriers to progress. So that's a really good thing to stop.
Mm-hmm. Perfect. Yeah, I'm sure there'll be lots of people that will be pleased to hear that. Excuse me. And I suppose one of the things that sprung to mind as you were talking about bureaucracy and it essentially challenging why are we doing this reporting, what's the purpose that it's serving, is it's kind of around that permission for staff to challenge in a respectful way, and almost, I suppose I actually just wanted, you know, tips for being able to do that in a way that it demonstrates that respect and that sort of, we know that we do need some level of bureaucracy, but actually if you feel like this is a bit excessive or there's different ways to doing it, how would you advise staff to go about having that conversation with senior managers or different people that they might need to talk to?
Yeah, I think my view would be get involved. Don't be shy. Be confident. As you say, you know, do it in a respectful way is important. But our staff are, and I'm sure they would do that. I think one of the tips would be around. So this is based on my experience of being a clinician for 30 odd years. I understand and know what it's like to work in clinical services, and I know therefore that clinicians will often have ideas about how to do things better and how to improve. But likewise too, you know, we've got experts in fields, in estates and facilities and HR, etc., that know what they're doing, and they know how to improve things. And we need to create a culture and environment where people feel able to say, well, actually, if we did like this, it'd be much better because. So I think my tip would be about if there's an issue or problem, be solution focused, bring some options, bring some alternatives, don't be a commentator, and be a leader. You don't have to view leadership as a hierarchical thing. My view is that everybody can be a leader. You know, if you're confident and competent in the role that you're doing, you can lead and improve. So yeah, be solution focused, bring ideas, bring suggestions.
I like that. Very good, thank you. And what about things to start then? What are you noticing? Maybe things that need to be brought in or altered or changed or done, but they are starting things. What do you need to start?
Yeah, I think that's probably a bit more of a difficult question, and perhaps need to think it through, because in my head I immediately go to sort of larger scale transformational pieces. And I know that for example in the bigger divisions they're starting to look at for example quite a significant transformation piece about how local mental health teams work into communities. There's been a massive transformation in the community health service division around facilitating discharge of physically unwell people from the acute hospitals, either into our facilities and teams or getting them home. And both those things are emergent and have only just therefore started, but we need to make sure that we can progress that with maintaining the focus on supporting staff to do their job and getting good outcomes for patients. I think there'll be. I think we probably need to do more analysis about the start, because I think the other thing that COVID's done is, from a system point of view, so with all the other organisations in the county under the the ICS banner, the integrated collaboration that we're doing. COVID has actually managed to progress that much more than we were doing before. So I think we're going to be able to start much more rapidly. For example, how our trust and our teams work into primary care, work into the social care sector. We're already started to work in supporting care homes, and I think that agenda is going to grow quite rapidly. And we need to put our thinking into how that works best.
Absolutely. It's exciting though, isn't it? Those changes and thinking, but it's that taking that time to plan it, and the systems working is so multifaceted, so complex, and thinking about all the different parts, the different elements.
It is, but I think sometimes we make it more complicated than we need to. So we've got a couple of examples already in the trust, haven't we? We've got a brilliant musculoskeletal service where we do some joint working with Sherwood Forest Acute Trust colleagues, that's been a transformative piece of work, and we've been able to create a team that works across organisational boundaries, that's largely patient pathway based. And if you go back to those sort of principles of, what's the population that we're looking at, what's the best practice pathway that we can develop, and who are the people that and specialties that you need in it. If you go from that way, staff will say, well, if we did this and if we did this and if we did that, and you can create it. I don't think we do enough of that. I think we often come at it from the top, saying, this is the plan, this is what we're going to do, whereas we need to be much more in I'm sure there's language that your OD teams will be using about how you build that up from the bottom.
Absolutely.
To create that. So that's more start stuff, I think.
Yeah, absolutely. Thinking about that's just made me think about having those different people around the tables, doing some appreciative inquiry, really sort of dreaming, what do you want it to be like, how do we get, and then navigating that path towards those new ways of working. That sounds really good.
Yeah, because people often say, and it's a truism, isn't it, that when you're a patient, and we're all patients, the patients don't see any organisational boundaries; they just see NHS. And why should there be, referral pathways and waiting lists and blocks, and you don't meet the criteria for this? I think that COVID has shone a bright light on a lot of this sort of stuff, and I think if we're smart, we can use it as an opportunity to redescribe how our systems work. But the really important thing is that we work with our staff and patient involvement groups so that we make sure that with this opportunity we describe it well.
Yes.
And that people feel and obviously need to be involved in the description of how things can work better for the future. The optimistic view is that there will be more money coming in. We've heard that a lot, haven't we? I remain an optimist, and particularly for mental health and learning disability, it's a national priority for increased funding. So hopefully that will oil the wheels.
Perfect. Excellent. Oh, thank you, John. That's been really, really interesting. A really nice insight, I suppose, into your thoughts and where we're going and what we can be doing.
You're very welcome, Alison. What about yourself? Are there any things that leap out from you in terms of your own personal experiences or working in the last 2 or 3 months in COVID times?
Yeah, I think for me, it's been a very strange time, obviously for lots and lots of people, and it's been interesting working from home more and having the ability. I've always had the ability. We've always worked very flexibly in our teams, you know, but that ability to work from home more has been good, and yet for me, I do miss the contact and the team nature and seeing people. So from a development and training and teams perspective, I really like the people, getting people together, and I miss Vision 21. I miss seeing all the people and seeing them building their relationships and their networking, and we've done some coaching learning sets via Teams just in this past week, and it's okay, and it works, and it stops some people from having to travel a really long way. But at the same time, it's just something about having people together, and really you walk into a room and you switch everything else off, and you're there and you're present, and you know. So I miss that, and I'll be interested to see how we can move things forward to have maybe a blended way of working around that kind of thing. And we're looking at doing our behaviours in practice charters, and we're trying doing some of those through Teams as well. You know, for some groups of staff. For other groups of staff, I went into QMC to the DPM team a week or so ago, and we were able to socially distance, so we could do that. But again, it's just different ways of working. It's being creative and actually pushing those boundaries, I suppose, is what we're thinking around, is getting out of your comfort zone of, this is how we've always done it. Actually, no, this is what we could do, and why don't we try it this way? And well, it might not work, but we'll try it and just see what happens. So it's been an interesting journey, and we'll just see how we go. But I miss my colleagues.
I think you're right. We need to make sure we don't get into just living in an MST world. Good as it is, you're right, we need a blended approach, because the most important thing, I think, is we are human, and human contact and being with people is the best place to be. And we need to make sure that we create a varied environment, don't we, for people to work in, that's flexible too. We did our we managed to get an executive team away day where we could all socially distance in a large room, and we did our behaviours into practice piece, which was a really good session. It took us about 45 minutes to have a conversation around the 5 values, which was really informative and helpful. We're going to publish that once we just need to sort of get it written up. So no, I think I'm really looking forward to reading Team's feedback on that, because I think it's a great piece of work.
Excellent. Yes, me too.
Brilliant.
Perfect.
We're all done then, I think.
Yes, I think so.
Really enjoyed that, Alison. Thank you very much for getting involved.
Thank you. It's been good. It has been good.